Hello my friends, I'm Dr. Knowledge. Today I'm going to talk about urinary incontinence in women. Urinary incontinence refers to a loss or leaking of urine due to a faulty bladder control. It's a common misconception that this is a normal part of aging. It's not. Thankfully, there are lots of ways to manage urinary incontinence and minimize the effects it has on your life. Let's begin with stress incontinence. It occurs when pelvic floor muscles weaken. This condition is the most common type of urinary incontinence in young women. Activities like exercise, walking, stretching, bending, laughing, coughing, sneezing or lifting place strain on weakened pelvic floor muscles, and that leads to leaks. Weakness of the pelvic floor muscles and tissues that support the bladder and urethra causes stress incontinence. These muscles and tissues may be weakened by a variety of things. Anything that damages, stretches or weakens pelvic floor muscles may lead to stress incontinence. Some causes cannot be changed. Increasing age and female gender increase the risk. Pelvic floor surgery, injury to the nerves in the lower back, chronic coughing, smoking, obesity, and pregnancy and childbirth are also causes. Second type we're going to talk about is the urge incontinence. It occurs due to overactivity of detrusor muscle. The hallmark symptom of this kind of urinary incontinence is a sudden, overwhelming urge to void, accompanied by loss of urine. Frequent urination and nighttime urination often occur with this type of urinary incontinence. Hearing running water or changing position may trigger bladder contractions and lead to urine loss. The causes of urge incontinence fall into two main categories. Irritation within the bladder is one potential underlying cause. The other is a loss of the nervous system's inhibitory control of the bladder contraction. Neurological conditions like stroke, Parkinson's disease, multiple sclerosis, and damage to the spinal cord may injure nerves that control the bladder and lead to urge incontinence. Diabetes and cardiovascular conditions can also affect associated nerves. Alcohol consumption and diuretic medicine may underline urge incontinence. Infections or inflammation that either irritated the bladder or damaged its nerves may also trigger symptoms. Besides stress and urge incontinence types, certain medication may trigger urinary incontinence or make it worse. Drugs that affect the brain nervous system, muscle tone, and fluid balance may trigger the problem. Blood pressure medications may relax the bladder, increase coughing, or decrease the tone of urethral sphincter, all of which may contribute to this health concern. Pain relievers may increase fluid retention or relax or inhibit contraction of the bladder. Drugs to treat depression, Parkinson's disease, or psychosis may increase the retention of urine. The doctor can determine what kind you have by taking a detailed medical history, reviewing the nature of your problem, and ordering lab tests. The doctor will perform physical exam noting any aberrations. He or she may ask you to perform a cough stress test where you stand and cough to see if it provokes an accident. Post-void residual urine test assesses how much you urinate and the amount left over after voiding. The test helps determine if there is an obstruction in the urinary tract. The urodynamic testing is a specialized testing that can assess how well the bladder, urethra, and sphincters store and dispose of urine. To manage urinary incontinence, first there should be some lifestyle changes. Drink adequate fluids to avoid dehydration, but don't drink too much. Limit your intake of fluids after dinner in the evening to minimize nighttime accidents. Avoid caffeinated drinks like coffee, tea, and colas, as caffeine is diuretic. Avoid alcohol, smoking, and carbonated beverages, which may contribute to leaks. Losing weight if you are overweight may help relieve pressure on the bladder. Also, getting adequate fiber helps move your bowels, which in turn helps minimize the risk of incontinence. In addition to that, strengthening pelvic floor muscles can reduce or even cure symptoms of stress incontinence. Kegel exercises target the muscle that control the flow of a stream of urine. You need to do the routine regularly to attain and maintain maximum benefit. To perform Kegel exercises, contract the muscles you use to stop a stream of urine, hold for 3 seconds, and then release. Relax for 3 seconds. Work up to 3 sets of 10 Kegels. Check the link below for the best Kegel exerciser app and vibration Kegel balls for tightening and pelvic floor exercises. Another way to manage the incontinence is by pessary, which is a device used to treat this problem. The device is inserted into the vagina by a doctor or a nurse. The pessary pushes into the vaginal wall, affecting the position of the urethra, so that leaks are less likely. Check the link below for the best pessary support kit. Medications to treat urinary incontinence fall into several major classes. Antispasmodics decrease bladder contractions in an attempt to minimize leaks. These medications are available in pill form. Some are available as extended release forms or transdermal patches, which you can find in the link in the description. Antidiuretic hormone is also prescribed to help the body retain water and makes the urine more concentrated. If behavioral and lifestyle interventions do not bring relief of urinary incontinence, electrical nerve stimulation may be an option to consider. Small devices implanted near the tibial nerve in the ankle or the insacral nerve in the lower back deliver impulses that help relieve urinary incontinence symptoms. In some cases of urinary incontinence and responsive to other treatments, a physician may inject bulking agents near the urinary sphincter to help close the bladder opening. A mixture of collagen and carbon beads are injected under local anesthesia. About 30% of those who undergo the procedure have a successful outcome. Despite your best efforts, accidents may still happen from time to time. There are many products that can help you feel confident being out and participating in the world. Adult diapers are also an option to stay dry in the event of an accident if you tend to leak large amounts. Find the best quality in the link below. Disposable pads worn in underwear may be enough protection if you are prone to smaller accidents. Waterproof underwear is another safeguard to help keep clothing from getting wet. Check the best product in the link below. Still, the best treatment for incontinence is prevention. Exercise regularly to boost your overall health and keep weight within a healthy range. Certain foods may irritate the bladder and increase inflammation, both of which may trigger or exacerbate urinary incontinence. Potentially problematic foods and beverages include tomatoes, citrus drinks, and highly acidic foods. Spices, alcohol, and chocolate may provoke bladder irritation and leaks. If you are unsure whether diet plays a role in your symptoms, keep a food diary and note what you eat and drink prior to experiencing symptoms. Thank you for watching and goodbye.